Welcome to This Explainer. Today, we're diving into something super urgent. What actually happens inside your body when you completely ignore your health checkup results? We're going to unpack some fascinating straight-from-the-source insights from Dr. Kazu, who is a highly experienced neurosurgeon. He's going to help us decode exactly what's going on in your head when you put off that doctor's visit. So if you've ever glanced at a medical form, felt that little knot in your stomach and thought, nah, I'll just deal with it later, well, let's be totally honest for a second here. Is your latest health checkup envelope currently sleeping in a drawer somewhere? Or, maybe it's buried under a mountain of mail on your kitchen counter? Look, we all do it. The excuses we make are incredibly common, and honestly, they're completely understandable. You might tell yourself, I'm just way too busy with work right now to go to a hospital. Or, if we're being really real with ourselves, you might just be terrified of what they might actually find. Or, there's the most dangerous excuse of all. You feel perfectly fine, so you just assume you must be healthy. But as we're about to see, relying on how you feel, that can be a massive, massive trap. Section 1. The hidden danger. So to really wrap our heads around this hidden danger, let's look at what our expert, Dr. Kazu, has to say. He's a former university associate professor and a frontline neurosurgeon who literally operates on strokes and brain tumors every single day. I mean, the guy spends his life looking directly at the brain's blood vessels. And he's got a major warning for us. In many of these comprehensive medical checkups, an E rating is the absolute lowest grade you can get. Okay? It is absolutely not just a friendly suggestion to, maybe eat a little healthier. An E rating means you need an immediate, detailed medical exam. It's a blaring biological alarm going off in your body. When you get that E rating, especially if it's for blood pressure, cholesterol, triglycerides, or blood sugar, you're not just looking at boring numbers on a page. You are staring at a direct threat to your brain health.
Section 2. Brain's water pipes.
The source material uses this fantastic metaphor to explain exactly why those numbers are such a big deal. Think of the blood vessels in your brain as these ultra-precise, incredibly delicate water pipes. They're basically the intricate plumbing system keeping your body's command center online. But unlike the tough iron pipes under your kitchen sink, these biological pipes are super sensitive to whatever is flowing through them. Take a look at that massive 20% on the screen. A staggering 20% of your body's entire blood volume is constantly rushing into your delicate brain at any given second. Your brain is a really greedy organ. It demands this massive nonstop supply of oxygen and nutrients. And because so much blood is being forced through those tiny fragile pipes, they get put under immense strain if your blood gets thick and sludgy or if the pressure pushing it is just way too high. Which brings us to the two big threats of ignoring that E rating. First, if you ignore high cholesterol, you're looking at vessel clogging. It's literally just like pouring grease down your kitchen sink. Plaque, which is essentially microscopic cellular garbage, builds up on the walls of your vessels. It makes the passageway narrower and narrower and narrower until, boom, it completely blocks the flow. On the flip side, if you ignore high blood pressure, you're facing vessel bursting. That constant pounding high pressure pushes against those delicate walls, making them swell up like a balloon until they finally just snap. Both of these scenarios cause a stroke, and both are absolutely devastating.
Section 3. The silent killer.
Now, this brings us to a pretty terrifying medical reality. Why do so many people let things get so bad that a vessel actually blocks or bursts? Well, it's because of what doctors call the silent killer effect. Not having any symptoms doesn't mean you're in perfect health. Actually, it's a massive, dangerous trap that lulls you into this false sense of security. Here is the absolute crucial point. The blood vessels inside your brain, they have absolutely zero pain nerves. None at all. You can't feel them. That means you could have a blood vessel that is literally 99% clogged with plaque, or swollen to the absolute brink of bursting from high blood pressure, and you'd feel perfectly fine right up until the exact second it fails. The perception is, hey, I have no symptoms, I'm good. But the medical reality, by the time you actually feel a symptom in your brain, you are already in a severe medical crisis.
And that leads to this really haunting reality in the operating room. Dr. Kazu points out that the vast majority of stroke patients who get rushed through his doors were living completely normal lives just hours before. They just collapsed out of nowhere. And you know the most common thing he hears from patients who survive, or from their grieving families? If only I had gone to the doctor for a recheck last year. They had the warning sign. They had the envelope sitting right there in the drawer, but they waited too long. Section 4. Medical Action Plan. Okay, we definitely do not want you to be that person in the operating room.
So let's lay out a clear, exact roadmap of what you need to do right now to keep those delicate water pipes in pristine shape. Look, an E rating is entirely manageable if you just take action. It's actually super simple. Step 1, just look at your checkup results and see exactly what triggered that E rating. Step 2, know where to go. If it's blood pressure, cholesterol, lipids, or blood sugar, go ahead and book an appointment with an internal medicine or cardiovascular clinic. If your E rating came from a head CT or MRI abnormality, then head straight to neurosurgery or neurology. And step 3, just bring the envelope with you. Seriously, if trying to figure out which specialist to see feels too overwhelming, just take your results to your regular, everyday primary care doctor. That is a perfectly valid, excellent first step.
So once you actually get to the clinic, what's going to happen? Well, they're going to run some highly precise, completely painless tests to figure out exactly what's going on. For instance, they might order a brain MRI to check the cross-sections and the exact shape of your blood vessels. Or they might use a neck ultrasound, which is this really quick, easy scan that checks the large, thick vessels in your neck to make sure there aren't any dangerous blockages cutting off the blood flow to your brain. They might even do a 24-hour blood pressure test just to accurately measure the ongoing strain your system is under.
And honestly, here is the best news of this whole explainer. If they find an issue before it bursts or completely blocks, modern medicine has some incredible, proven ways to fix it. If you catch it early, it might just be as simple as taking a daily medication to safely lower your blood pressure or clear out that cholesterol. If a vessel is already dangerously narrow, doctors can use endovascular catheters. These are tiny little tubes they insert into the vessel to literally widen it from the inside out. It's amazing! And in more extreme cases, surgical reinforcement can directly repair the dangerous sections of the pipe. You have so many options, but only if you get checked.
Section 5. 3 Protective Habits.
Now, beyond the medical treatments, there are practical, everyday things you can start doing right this very minute to protect your brain's crucial water pipes. You don't need a prescription for any of these, but man, they are incredibly powerful for keeping your blood vessels healthy. Let's break down these 3 protective habits. First up, try to reduce your salt intake by just 1 gram a day. The source gives a great practical trick for this. Just dip your food in soy sauce instead of pouring it all over your meal. It drastically cuts your sodium, which lowers your blood pressure. Second, take a 20-minute walk every day. Moderate exercise like that significantly improves your blood flow and keeps those vessels nice and flexible. And third, prioritize high-quality sleep. Getting good sleep naturally lowers your blood pressure at night, which gives your delicate vascular system a much-needed break from all that daily pressure.
So, the next time you look at that piece of paper, you really need to reframe how you think about it. An E rating is not a sentence of despair. Not at all. It is a rescue sign. It's literally a direct message from your own body giving you a chance to protect your future. Prevention is entirely possible, and a long, healthy life is completely within your grasp. You just have to act on this information before those silent symptoms turn into a loud, irreversible crisis.
Which brings us to the final, and definitely the most important question of this whole explainer. Are you going to book your follow-up appointment right now? Don't tell yourself you'll do it tomorrow. Go find that envelope in the drawer, pick up your phone or open your clinic's app, and schedule that appointment. It could literally change the course of your entire future. And hey, if you know someone, a parent, a friend, a coworker who has been dodging their health checkups, please share this vital knowledge with them today. It might just save their life. Thanks for learning with me, and please take care of yourselves.